On December 31, 2019, the World Health Organization's China office heard the first reports of a previously unknown virus behind a number of pneumonia cases in Wuhan, a city in eastern China with a population of over 11 million. The disease appears to have originated from a Wuhan seafood market where wild animals, including birds, rabbits, bats and snakes, are traded illegally. Coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome. In 2019, a new virus called the severe acute respiratory syndrome coronavirus 2 caused a disease outbreak in China. The disease is called coronavirus disease 2019, COVID-19. Public health groups such as the World Health Organization and the U.S. Centers for Disease Control and Prevention are monitoring the situation and posting updates on their websites. These groups have also issued recommendations for preventing and treating the illness. Signs and symptoms of infection with the new coronavirus may appear 2 to 14 days after exposure and can include fever, cough, shortness of breath or difficulty breathing. The severity of the new coronavirus symptoms can range from very mild to severe, even death. Although understanding of this disease continues to grow, most people with severe illness have been of an older age or had other significant existing medical conditions. This is similar to what is seen in people who have severe infections with other respiratory illnesses, such as influenza. Although there is no vaccine available to prevent infection with the new coronavirus, WHO and CDC recommend following the standard precautions for avoiding respiratory viruses as follows. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Avoid touching your eyes, nose and mouth if your hands are not clean. Avoid close contact with anyone who is sick. Avoid sharing dishes, glasses, bedding and other household items if you are sick. Clean and disinfect surfaces you often touch. Stay home from work, school and public areas if you are sick. Avoid eating raw or undercooked meat or animal organs, and avoid contact with live animals. 2,979 people have died so far from the coronavirus COVID-19 outbreak. There are currently 86,992 confirmed cases in 64 countries and territories. The fatality rate is still being assessed. In the Sultanate of Oman, the Ministry of Health confirmed the recovery of one of the 6 newly infected cases of coronavirus in the Sultanate, noting that other cases are still subject to health follow-up and are in stable health condition. His Excellency Dr. Ahmed bin Mohammed Al-Saidi, Minister of Health, revealed that about 1,320 travelers from countries infected with the virus have been quarantined. The Minister of Health confirmed the strength of epidemiological surveillance systems and the accuracy of the central laboratory checks in the Sultanate, which is a central laboratory in the Middle East region. The ministry called upon all citizens and residents coming from countries which are affected by the coronavirus to stay at home and report at the ministry if any signs of symptoms observed. The statement also urged people to avoid traveling to these countries. In the meantime, the Public Authority for Civil Aviation said that all flights to and from Iran will be suspended until further notice. Oman Air and Salam Air halted all flights between the Sultanate and Iran since Monday and until further notice.